Developmental and cognitive challenges. Definition: sub-average intellectual functioning originating during the developmental period and associated with impairment in adaptive behavior, formerly known as mental retardation. Not the same as mental illness. Label represents a highly heterogeneous group of persons, most commonly developmental disability. The incidence: 2% to 3% of the United States population, 57.7 million total, depending on criteria. Levels of intellectual disabilities. IQ, mild. Approximate IQ, 50 to 70, or 89%. Moderate, approximate IQ, 40 to 55, 6%. Severe, approximate IQ, 25 to 40, or 3.5%. Profound, IQ below 20, or 1.5%. The etiology: acquired, 12%, inherited, 13%, unknown, 75%. Viral infections and toxemias: rubella, meningitis, lead poisoning. Trauma and physical or chemical agents: child abuse, fetal alcohol syndrome. Disorders of metabolism or nutrition: phenylketonuria, PKU. Gross brain disease, atrophy, or neoplasms. Genetics: gestational disorders, Rh incompatibility, anoxia, prematurity. Environmental: lack of stimulation. Signs, symptoms, and clinical manifestations: variable depending on etiology and individual circumstances. Unusual difficulty in learning and applying what is learned to issues of daily living. Skull or other craniofacial anomalies may exist. Microcephaly, small cranium that restricts brain growth. Hydrocephaly, expansion of the cranium from excessive accumulation of cerebrospinal fluid. Malformation or asymmetry of growth. General developmental delays. Other possible manifestations include motor incoordination, mental deficiencies, visual or hearing disorders, specific learning disabilities, maladaptive behaviors, emotional disturbances, medical disabilities, and self-injurious behaviors. Oral manifestations. Most oral health problems are not inherent to the disability, but are related to extrinsic factors, neglect by caregivers, or lack of coordination leading to poor oral disease control. Decayed missing filled surfaces, DMFS score, comparable with those of the general population, but the decayed component may be higher because of the lack of professional treatment. Higher prevalence of periodontal conditions, probably related to poor oral hygiene and lack of regular care. Higher incidence of malocclusion and deviations in tooth eruption is associated with craniofacial syndromes and growth abnormalities. Some cases of enamel dysplasia, more frequently seen in those with severe mental deficiency, resulting from prenatal or perinatal defect or insult. Thick, flaccid lips, microglossia, bruxism, tooth anomalies such as microdontia, and abnormal eruption patterns.